Have you ever had a cut or a scrape that just seems to hang around forever, but then other times it's like it disappears in a flash? Well, I'm here to tell you it's not just in your head. The whole healing process can be super unpredictable, and it turns out one of the biggest reasons why might be right outside your window.
So let's get right into it. How on earth can the season, whether it's a hot summer day or a freezing winter night, actually change the way your body repairs itself? We're going to break down the science behind this because it's a pretty surprising connection and see exactly how the weather gets involved in your body's amazing repair work.
Okay, so in a perfect world, your body is an absolute pro at healing. It follows this four-step plan, right? First up is hemostasis, which is just about stopping the bleeding. Then comes inflammation, where your body rushes in to clean out all the gunk and bacteria. Third is proliferation. That's when it starts building brand new tissue. And finally, remodeling strengthens that new skin. It's a brilliant, super organized process, but that's only when everything goes right. The weather, well, it loves to mess with the plan.
All right, let's start with our first challenger, summer. We usually think of summer as this healthy, active time, right? But for a healing wound, summer can be a really hot, humid enemy.
Now here's where it gets interesting. Summer isn't all bad. The heat actually makes your blood vessels widen. It's called vasodilation. And this can boost blood flow to your skin by up to 65%, which means more oxygen and more healing cells get to the wound. But, and believe me, it's a big but, this benefit comes with a massive, massive risk: infection.
The real bad guy in the summer healing story is moisture. All that humidity in the air, combined with sweat, creates this really wet environment right around your wound. This can actually cause the skin to break down. It's a condition called maceration, and it makes your bandages get loose, leaving the wound totally exposed.
And this chart really shows you just how dangerous that is. Just look at the difference here between normal skin and that oversaturated, macerated skin. Studies have found that just having too much moisture around a wound boosts the infection risk by a staggering 30 to 40%. That moisture is basically rolling out the red carpet for bacteria.
So here's the bottom line. That warm, damp environment is pretty much a paradise for bacteria. All those nasty characters like Staphylococcus and Pseudomonas absolutely thrive in these conditions. They multiply like crazy and make the whole healing process way more complicated.
And just how much do they love it? Well, one study found that the growth of bacterial biofilm, that slimy shield bacteria create to protect themselves, is a massive 45% higher in the summer. That is a huge advantage for them and a huge problem for you.
Okay, on to our second challenger. If summer's threat is like this hot, humid invasion, winter's is more like a cold, quiet siege. It's a totally different kind of danger, but believe me, it's just as serious. So winter's main strategy? It's to cut off the supply lines to your wound. The cold air makes your blood vessels tighten up, a process called vasoconstriction. Your body is basically doing this to keep you warm, pulling blood away from your skin and towards your vital organs. And the effect is pretty dramatic. Being out in the cold can slash blood flow to your skin by up to 50%. That means half the oxygen, half the immune cells, and half the nutrients are actually reaching your wound. You're basically starving it of everything it needs to heal. And the cold air has an accomplice: low humidity. That dry winter air just leaches moisture from your skin, leaving it brittle and really prone to cracking. And all those tiny cracks become easy access doorways for bacteria, letting them bypass your skin's main defenses.
But wait, there's a hidden factor here too. Less sun in the winter means your body makes less vitamin D, and that's absolutely crucial for a strong immune system. Research actually shows that patients with low vitamin D can see a 35% delay in their healing.
And here's the final blow. We all tend to be less active in the winter, right? Well, that lack of movement can lead to fluid pooling or edema, especially in our lower legs. This just puts more pressure on the wound and really slows down the healing of things like venous ulcers.
So how much of a delay are we actually talking about? Well, one study found that for people with venous ulcers, being less active during the winter added an average of 21 extra days to their healing time. That is 3 whole weeks.
Okay, so we've got two very different opponents here. Summer comes at you with a frontal assault of bacteria and moisture, while winter wages this war of attrition, starving the wound of all its resources. Let's put them head to head. So at a glance, the conflict is pretty clear. In the summer, you're fighting off infection and that skin breakdown from too much moisture. In the winter, you're battling ischemia, that's the lack of blood flow, and cracking from extreme dryness.
Now let's really get into the details. You can see how they're almost perfect opposites, right? Summer gives you high blood flow, but you pay for it with dangerously high humidity and infection risk. Winter has a lower risk from bacteria, but the blood flow is critically low, and your skin gets super dry. The takeaway here is pretty clear. Neither season is perfect. Healing speed either fluctuates like crazy in the summer, or is just plain slow in the winter.
So, what in the world can you actually do about all this? The key isn't to be afraid of the seasons, it's to adapt to them. Your wound care plan needs to change right along with the calendar. For summer, your whole game plan is about moisture control. You want to use highly absorbent dressings to pull away all that sweat. Change them often, especially if you've been outside or active. And of course, stay hydrated to help your whole body function better. And just keep an eye out for any of those early signs of infection, like redness or extra pain. In winter, the strategy totally flips. Now the priority is protection and circulation. You need to moisturize the skin around the wound every day to stop it from cracking. Keep your body warm to encourage that blood flow, but, and this is important, never put direct heat right on the wound itself. Find ways to stay active inside and maybe even talk to your doctor about checking your vitamin D levels.
When you get right down to it, as one study perfectly puts it, temperature and humidity are critical factors in wound healing. It's such a simple truth, but it reminds us how much our environment really affects all the complex stuff happening inside our own bodies.
So, what's the real bottom line here? Each season brings a totally unique challenge. Summer's heat and humidity create that perfect breeding ground for infection, while winter's cold and dry air literally choke off the vital blood supply. Understanding this is the absolute key to creating a smart, adaptive care plan that actually works.
Look, this isn't just some fascinating science fact. It's practical knowledge that can genuinely help you heal faster. So as the seasons start to change, the real question you have to ask yourself is this: is your wound care plan ready to change with them?